Today I'm going to discuss with you on the treatment of President Trump's COVID-19 virus infection. And as we all know that there's no approved drug for COVID-19 infection treatment. And so far we have some drug in the market, but just for compassionate use or for emergency use. And as soon as President Trump was diagnosed with COVID-19, and relatively aggressive treatment was given to President Trump. At this moment, at least 2 experimental drugs was given to President Trump. One is the neutralization antibody cocktail, and another is remdesivir. So we know this is this is the coronavirus, and for treatment of this virus infection, and the cocktail antibody actually is the antibody, and the antibody was generated from human immune system and the protein, and the antibody was used to bind into the spike, and in this cocktail there are 2 antibodies and bind to different part of the spike. So that's provide double insurance. So just in case one antibody is not effective, and another antibody may have some effectiveness. So as soon as the antibody binds to the spike protein, and this virus then cannot get into the human cells, we know that the virus need human cells to replicate. If they cannot get into the human cells, and then they cannot replicate, generate more virus. And meanwhile, this virus in outside of cells, the immune system will going to recognize this virus. And in the immune system, there's a lot of cells like macrophage and also leukocyte. They attack this virus, and then the immune system is going to destroy the virus, so the people will not get sick. And the person was given to 2 antibodies, and only single dose of the antibody was given as soon as on October 2nd. And this is 8 grams of antibody was given to the president. And I think this is a right decision, because it's very important to prevent this virus get into the cells, because as soon as one virus get into the cells, they can replicate rapidly, and they can generate millions of virus and then infect new cells. So give the antibody early will have some kind of advantage to prevent of the virus to get more from the cells. And I should point out that Regeneron is actually in the phase 3 clinical trial to evaluate this drug, its safety and effectiveness. Right now, have already tested about 3,000 people. There's no any significant side effect, and that may be the reason they are so confident to give this drug to President Trump. And as I mentioned, that President Trump just gave this drug as compassionate use. And if you want to use this drug, you need to talk to your physician, because you cannot just go to the drug company, ask for it, and you need to ask your physician to initiate this requirement, and direct from the company. And in the company, there's a committee going to review your application and then decide to give you or not for compassionate use. I should point out this trial right now is still ongoing. So today is October 4th, if you watch this video right now, you may have a chance to participate on this clinical trial. But after 1 or 2 months, they may already enroll enough patients for the trial, and the trial may be closed. But right now, if you watch this video, you may have a chance to use it. So, who can participate on this clinical trial? So, first of all, you must be at least 18 years old, and then either you have been diagnosed with this virus infection, or your household member has recently been diagnosed with this virus infection. That's really good advantage for yourself, because this antibody have potential to prevent you from virus and to replicate more. That's nice. If you can join the clinical trial, this really have huge benefit to you. If you suspect you have this virus infection, and that's about this cocktail antibodies. Another drug was used for treatment of President Trump's COVID-19 infection is remdesivir, and remdesivir already approved by FDA for emergency use, and this very detailed discussion on how to use this drug, and also maybe millions of people already use this drug. So the safety profile should have no issue. And I think President Trump gave this drug on Saturday as soon as he went to the hospital. So this drug you should give 5-day treatment. So in this case, I guess President Trump will be in the hospital for at least 5 days in order to get this drug. And again, and this drug is also for emergency use. But I think this you need right now. Gilead Sciences need you to pay for this drug, and it costs you about $3,000 to have this remdesivir treatment. And that's the update for this experimental drug treatment. But another important fact is this supportive therapy. So we know that many people infected by this virus, but only few people get sick. So if you have strong immunity, and then the chance to get sick is pretty limited. So you need to have very supportive therapy. That's just like routine. You need to have good sleep and have if you like, eat some vitamins, and also think vitamin D already have trials that have some kind of benefits. If you can try to have this supportive therapy, and to make sure your immune system is strong so that virus cannot get into your body. Of course, the most important thing is that prevention, and you need to take preventive measures to try to prevent this virus getting into your body. This is most important. And so again, wash your hand and have practice social distancing, and that would be prevent you from this virus infection. And that's video for today. I wish everyone have healthy and happy life, and I wish to see you in my next video. Thank you.